Hello everyone. Let me make sure, I guess. Okay, it's going to let me move it this time. This is my second recording. On this computer, I don't have the option of having my video along with it, so you'll just hear my voiceover. We're going to pick up on state health departments and their relation with public health that we stopped off on Monday with going over typical responsibilities of state health agencies. So these next couple slides, you're going to find foundational areas. And what this means is that all public health agencies must address these certain categories, which includes communicable disease control, chronic disease and injury prevention, environmental health, maternal, child, and family health, and access to and linkage with clinical care. An example of this would be this poster that you see over here, which the CDC did design, but it was rolled out on the state level through state health agencies and through agencies such as WIC, and other type of family planning places where they had to re-educate the public and re-educate primary care providers, including OBGYNs, about how long a pregnancy should last. So up until recently, you were able to have an elective induction of your pregnancy around 37 weeks. So either you or your physician could do that for non-medical reasons. Now we understand that the baby does suffer some detrimental effects from that, and it also can increase mom's rate of dying as well. And so since we already have a high infant and maternal mortality rate and morbidity rate here in this country, we have decided that it's best practice to let the pregnancy continue on until about 42 weeks, unless there is a medical necessity to induce that mom. So that is just one example on kind of what a typical responsibility of a health agency will do. Now, foundational capability, so these are things that they have to have as a responsibility to do, is to assess. We've talked a lot about assessment. So again, that's that surveillance, epidemiology, so the tracking and finding where certain illnesses are coming from. And then all states have to have some type of laboratory capacity. They have to have all hazards preparedness and response, policy development and support, communications, community partnership development, and organizational competencies. So basically, you're going to see they have to help the public survive in threatening circumstances, whether that's terrorism or natural disasters. They have to have good communication with the public. They have to be well connected enough to their community partners to come up with plans in these situations. And then they also have to have organizational competencies, which largely comes around how well is your organizational ran and how well trained are your employees. Some expanding and emerging responsibilities come with that emergency preparedness and response. As we mentioned on Monday, because of climate change, we are seeing some harsher weather conditions. As you guys probably have put together, we didn't have class earlier today because it is very much colder here than it normally is. So that is one effect of climate change, is extreme temperature swings and just unprecedented amounts, either high or low. So preparedness involves building, maintaining, activating, and implementing the systems required to anticipate, respond to, and recover from all hazards, such as natural disasters, bioterrorism, and disease outbreaks. So your state health agency has to have contingency plans in place for any that are foreseeable to actually happen in the future. And this is an example, again, coming from the CDC, about how states that have, they're in the high hurricane areas, can teach their people how to be ready for a hurricane as best as possible. Some other expanding and emerging responsibilities center around regulatory function with respect to hospitals and trauma and emergency medical systems, and then also direct healthcare delivery. So especially in areas where we have a lot of underserved people, maybe it's really rural and hospitals have closed because funding is low, or there's been a big conglomeration of hospitals in a certain area that has left the rural people in the surrounding areas destitute when it comes to healthcare. Then the state health agency and the local health agencies generally will come in and start providing services for pregnant women and children. These could be pap smears, cancer screenings, sometimes it's food delivery, sometimes it's, with WIC, not always. family planning, dental health, TB, HIV, and STI treatment, screening and treatment, and primary medical care. So I gave you guys a little example here on oral health, which is becoming more prevalent of a service to be provided in public health. And that's one of the reasons why, is because there's some pretty large disparities with it. You know, your mouth is a part of your body just like anything else, and it's kind of strange that with our current care system of having the type of insurance we have for our health, that it's generally not included. It's a separate plan that you have to purchase and actually qualify for in a lot of cases. So these numbers might shock you, but maybe not. Maybe some of you all haven't been to the dentist in the last year, but we do know that poor oral health has a direct link with poor overall health, and also lower quality of life and lower self-efficacy. So you see people not feeling like they have control over their life when they have poor teeth. And it goes into nutrition, self-confidence, even getting promotions at work if you don't have a presentable smile. So it is something to keep in mind. So coordination with Medicaid services. Some states, as we mentioned earlier in this slideshow, are separate agencies with their Medicaid system, and you can see the pie chart here that I made. Some are part of an umbrella organization where the state health agency and Medicaid are together. And then in some states, the state health official has Medicaid oversight. So there's different ways to go about that. Public health informatics, what this is, first of all, it's an emerging field, and if you really like computers and you really like coding and coming up with infographics and things like that, you should really consider public health. This is the systematic application of information and computer science technology to the public health practice, research, and learning. They're paying big money right now for people that are capable of taking research and pulling out the statistics that matter and putting them into a viewable, condensed, easy to understand version for the general public. So if you feel like you might have a skill set there, public health really could use you. Data collection and analysis are critical functions to help identify changing needs for health programs and emerging threats to the public health. Not only do you need to educate the health professionals that are doing this job, but then they can also use those materials, if they're well done enough, to help educate their populations. Electronic health records, we've mentioned before. This gives a little bit more of an in-depth view to what that means. So first of all, high-tech legislation. This is actually legislation that happened going through Congress, U.S. Congress in 2009, that implemented the use of electronic health records in 3 separate stages. We are finally to stage 3 at this point. And the first stage was data capturing and sharing, so coming up with these systems, getting information into them, and trying to interface them with other systems as much as possible. There's still a lot of a long way to go with how many systems will interface with each other, but it's getting better. Then we went to advanced clinical processes. So let's say at the hospital, now we have an electronic record system. And now we have that hooked up with, a definite list of diagnoses that I can put on a patient, and a definite list of what types of interventions go along with those. So it takes a lot of the subjectivity out of what you're doing and really puts in that evidence-based practice of what the research says are our best options. Now, of course, as a clinician, I can always put in there, something extra, but for the most part, during the disease process, when you're treating it, there needs to be a defined way that you do that according to what has actually proven to work in the research. And then, of course, we have this theory, and hopefully it's a good theory, that once we have the right amount of data and a really nice medical history, and we have these clinical care practices and processes that are proven to work, then we will see the improved health outcomes. So that's finally where we are, tracking that data and starting to evaluate that data. I've mentioned this before, but this is just another reiteration of it, is that healthcare providers are required to submit certain information to state health agencies for public health purposes through the electronic health records, and one of that is the surveillance systems. I've given you all the example of the cancer surveillance system in Ohio, but we also have vital records. So anytime somebody dies or is born at a hospital, they would also be sending that through electronic health records. So some more about data collection and management. State health information exchanges are currently, like we have some, like for an example, we have a statewide immunization system where we have that exists, but it doesn't actually interface with any other states at this point. So if you were getting vaccinated in Pennsylvania at the beginning of your life, and then you got the rest of the vaccinations in Ohio, those systems probably don't talk to each other yet. So we do have some exchanges with clinical care, but we're really working on those connections still. Now, currently in the development is this public health community platform, and this is going to be like the mega health information exchange. It's going to be pretty much any data system that's out there able to interface with, and we can all work with in real time with real data. It's kind of scary, quite honestly, about how much is going to be at people's fingertips about you and about your community and about the health. But overall, we're really hoping that it's going to actually improve population health and individual health. Syndromic surveillance, I've alluded to this a number of times as well, but this is just a slide on its own about it. So this is population level surveillance of clinical syndromes like the cancer example that have a significant impact on public health. This one is more about, let's say, there is an E. coli outbreak or salmonella outbreak, and somebody, you can see this person here is symptomatic and he's going to go to the hospital for healthcare services. They're going to take down, probably do some blood work, confirm that it's E. coli, and then they're going to send the system on. So they're going to confirm it's E. coli with their laboratory system. And then they're going to go on with that data and put it in the Biosense platform, which is from the CDC. Well, then Biosense is going to do all the things that they do when it comes to data sharing and using the data and monitoring with their surveillance systems. And then they're going to let all of these other entities know, okay, we have a salmonella outbreak. Here are the criteria. This is what we're looking for. Put everything into this folder, and we're going to have an epidemiologist work on, trying to get this to a close and have as many lives preserved as possible. State health agencies are also in charge of communications like any other agency, and they deliver key messages to the public in times of emergency. So they have their own special radio channel, but they also use other social media outlets and commercial outlets when it comes to getting a hold of the population. They do communicate information from the federal government to the local government. So as you saw with the CDC posters that I used in the slideshow, yes, they came from the CDC, which is the feds, which we'll talk about in the next video. But they are actually the ones responsible for giving that information. A lot of times it's actually free posters. So you might get like 100 free posters sent to your health department for new anti-smoking campaigns coming from the CDC. So it's an example for that. We also collaborate with other agencies and facilities that require public health practitioners to speak the language of other disciplines. So there's a lot of collaboration. A lot of times when there's a particular problem, and let's say it's low breastfeeding rates, which is one that I'm usually involved with, then the state health agency will actually invite people to Ohio Department of Health in downtown Columbus to come from hospitals, different birthing practice centers, WICs, of course, which is part of Ohio Department of Health in our state, and actually sit down at the same table and have some conversations about how we fix that problem. Community partnership development. So state health agencies partner with community leaders and organizations that are critical for effective functioning. This could be certain religious groups. It could be certain ethnic groups in your community. It could simply be people that are just well established and well liked. So different types of charitable foundations or big employers. This helps us gain insight into community health concerns. It seeks community buy-in for agency priorities. So they're out there working in the community. What do they see as the problems, and how can we help them fix those problems that they're seeing? We're going to work with partners to ensure that key messages are heard by community members, and we're going to hopefully get them to support policy development. So we heard you. We're going to come up with a plan based on what you told us and what the research says. And we're going to get some key messages out, so we're all being very consistent with what we're telling people. And in turn, we need your support when it comes to actually going through this policy that we're creating. Organizational competencies, so things that state health agencies need to have, is strong leadership or governance, but a lot of times you'll see here in a slide or two, the strong leadership is generally a